Which of the following is a priority nursing intervention for a patient who is experiencing dyspnea? Correct answer is option A. Administer oxygen as prescribed. A nurse is preparing to administer a subcutaneous injection to a patient. Which site is considered safest for this route? Correct answer is option C. Abdomen. The nurse is caring for a patient receiving opioid analgesic. Which of the following is a potential side effect of opioid therapy? Correct answer is option B. Constipation. A patient is diagnosed with fluid overload. Which sign should the nurse expect to assess? Correct answer is option C. Jugular vein distension. When performing a physical assessment, which technique should the nurse use first? Correct answer is option B. Inspection. A patient is diagnosed with a urinary tract infection. Which of the following is the most common symptom? Correct answer is option B. Urinary frequency. What is the primary goal of palliative care? Correct answer is option B. To provide comfort and relieve symptoms. Which of the following should the nurse do first when caring for a patient who has just returned from surgery with a wound drain in place? Correct answer is option A. Assess the drainage amount and characteristic. Which of the following is a sign of hypovolemic shock? Correct answer is option C. Tachypnea. Which of the following is the best position for a patient experiencing shortness of breath? Correct answer is option C. High fallers. Which of the following should a nurse monitor when a patient is receiving an opioid analgesic? Correct answer is option A. Respiratory rate. A nurse is caring for a patient receiving IV fluids. Which of the following should the nurse monitor closely? Correct answer is option D. Urine output and specific gravity. Which of the following is an example of a primary prevention strategy? Correct answer is option A. Administering a flu vaccine. The nurse is caring for a patient with a history of COPD. What should the nurse prioritize in the care plan? Correct answer is option A. Encourage deep breathing exercise. The nurse is preparing to discharge a patient with newly diagnosed diabetes. What is the priority teaching topic? Correct answer is option A. Blood glucose monitoring. A patient is receiving IV fluids and develops swelling at the insertion site. What is the most likely cause? Correct answer is option C. Infiltration. A nurse is caring for a patient with a fever. Which action should the nurse take first? Correct answer is option D. Monitor the patient vital sign. A nurse is assessing a post-operative patient for signs of hemorrhage. Which of the following should the nurse report immediately? Correct answer is option A. Decreased urine output. Which of the following is an example of a nurse acting as an advocate for a patient? Correct answer is option B. Educating the patient about their treatment options. Which of the following is the most common cause of a healthcare associated infection? Correct answer is option B, improper hand hygiene. Which of the following is a priority nursing assessment for a patient who has just received a blood transfusion? Correct answer is option C, monitor for signs of transfusion reaction. A nurse is caring for a patient who is receiving chemotherapy. Which of the following interventions is essential to prevent infection? Correct answer is option C, practicing strict hand hygiene. A nurse is educating a patient with chronic kidney disease about dietary changes. What is the priority teaching point? Correct answer is option B, decrease potassium intake. A nurse is caring for a patient with diabetes who is experiencing hypoglycemia. What is the first action the nurse should take? Correct answer is option C, administer glucose or sugar source. A nurse is caring for a patient receiving continuous intravenous fluids. What should the nurse monitor most closely? Correct answer is option B, electrolyte levels. What is the priority nursing intervention for a patient experiencing anaphylaxis? Correct answer is option C, administer epinephrine. A nurse is assessing a patient with a history of hypertension. Which of the following is the most important sign of impending hypertensive crisis? Correct answer is option A, severe headache. The nurse is assessing a patient who has had a stroke. Which of the following findings is most concerning? Correct answer is option B, difficulty swallowing. A nurse is caring for a patient with chronic kidney disease. Which of the following is most important to monitor? Correct answer is option A, serum potassium levels. A nurse is caring for a patient who is receiving blood transfusion therapy. What is the priority action if the nurse suspects a transfusion reaction? Correct answer is option A,